You are live here and now you're live here.
Hi everybody, this is Sarah, one of the nurses here at Pure Plastic Surgery.
Hi everyone, this is Ashley. I am the medical assistant here at Pure Plastic Surgery.
So we are going to talk about all things pre-op. So you will get a phone call 45 days to 60 days before surgery from one of our pre-op coordinators. They will go over the lab work you'll need to have done before surgery to be viewed by the doctor and our CRNA team. And they'll go over the medical clearance, being seen by a PCP or an urgent care to get a medical clearance letter. We'll prepare you for what to expect when you get here for surgery during this phone call, and really answer any questions that you may have about the surgery or maybe what to expect with the surgery.
Make sure that the moment that you guys book your procedures, make sure that you are signing your procedure agreements and that you are sending those over through Clara. Those are very important before you actually get the pre-op don'ts prior to surgery and after surgery as well.
Yeah, do's and don'ts, like what medications to stop, what medications to start to help maybe build your blood for surgery. And I guess one thing that I think is super helpful is how to get this process started after the phone call. So it's super important to have a doctor's appointment maybe already scheduled. Now that you know that this phone call is 45 days to 60 days before surgery, maybe have a doctor's appointment around that time as well, just to kind of get the process started.
Yes, and definitely keep in mind that based on your past medical history, the tests that we will require are different. So make sure that you have everything set up from once you receive the pre-op over the phone call.
Right.
And then just also keep in mind that medical clearance blood work is due 3 weeks prior to your surgery date. Payment is due in full 2 weeks prior to surgery date as well. And COVID test is due 7 days prior to surgery.
That's
Very, very important.
Yeah, so for example, maybe you have high blood pressure. A lot of PCPs will treat high blood pressure. You don't need a cardiologist. But we like to be very thorough in the pre-op process. We want to make sure you're safe in the OR. This is all about your safety. So we actually require a cardiologist clearance for a lot of conditions. So maybe looking ahead for a cardiologist, having maybe a possible appointment for that as well. So that you can just be really prepared to get your medical clearances done in other ways. You don't have to worry about it 2 weeks before surgery, 1 week before surgery. Really just be on top of it is super important.
Remember that they can ask the questions after the live, so in a few minutes they can start asking the questions.
Okay.
So random.
So also keep in mind that chest x-rays are required for patients 40 and older, or if you do have any history of asthma, childhood asthma. Mammograms also are for patients 40 and older, or any history of breast cancer.
That's right. Some helpful tips on how to get blood work, like maybe the process going to get blood work. We'll send an order over into your patient portal after the phone call is completed with one of the pre-op coordinators. So you can take that blood work and really go to what's most convenient. You can go to a Quest Diagnostic Center, you can go to a LabCorp center. Some PCPs will perform the blood draws in their office and process the blood work through their resources. So I think something that, at least for me personally, I ran into, I don't have a PCP. So I went to an urgent care to get my medical clearance. I got my blood work done at a Quest. So that was super helpful, and I think helpful for a lot of patients who maybe their PCP doesn't have an opening position for an appointment, or you don't have a PCP, that's an option too.
For sure.
Yeah. Any questions?
Yes, the questions are already here, and let me go a little bit up for the questions, girls. Just
Okay.
1 second. Okay, how long are the pre-op appointments when you're picking implants, and what
Okay.
should we bring?
I can do this one. So actually, the pre-op in person the day before surgery, or if your surgery is on a Monday, your pre-op appointment will be the Friday before. So that appointment is around an hour. You'll see the doctor, Dr. Earl or Dr. Vidal. You will do your breast measurements to check an implant that will fit your breast size. So that appointment, actually the day before surgery, is about an hour.
Okay, let's go to the second question. what vitamins should I take and what should I avoid before the surgery?
So you definitely want to stay away from any herbal supplements, any anticoagulants such as aspirin, Aleve, Advil. You want to stay away from birth control, steroids. You want to stay away from protein shakes, any protein drinks.
Protein
shakes. Yeah.
Yeah, a lot of protein shakes have a lot of extra vitamins, minerals. The increased herbals can thin your blood. So we want to just take as many extra precautions before surgery and make sure your body is like very simple and clean so that once you're in anesthesia and once you're out of surgery, it's a smooth recovery.
Yeah, definitely. And as far as what vitamins you can take any vitamin C, folic acid, Floridix, or Hemoplex. Great to boost your immune system prior to surgery.
Yeah.
Yes, okay. Well, I think this is for the doctors, but you
Okay.
can answer. Is how old do your patients have to be? The age limit.
Okay, this is a little specific. Depends on the surgery you want to have. Dr. Vidal performs liposuction procedures for patients 55 years old and under. Dr. Earl performs liposuction on patients 50 years old and under. And then as far as like breast procedures, tummy tucks, it's very case by case depending on maybe medical history, if you've had other complications from surgeries in the past. So reach out to our coordination team and we can do a questionnaire and get a little bit more information about what you're interested in, and then we'll let you know from there.
Okay. Let's go to another question here. Wait just 1 second, girls, please.
What is a question that you get a lot in like the pre-op appointments?
What do they have to wear?
Okay.
Yeah.
What to wear coming into surgery? Loose, comfy clothes, loose dress.
So I typically recommend like a robe or those pajama dresses that have the zippers, button down, something that's easy to take off
Yeah.
and put it back on.
Yes.
Yeah, definitely.
Yeah, and are you the doctors doing surgery on patients with multiple sclerosis? If so, is there any restriction to a certain surgery?
From my understanding, I do not believe we perform surgery on patients with multiple sclerosis. And if maybe you have other questions about your condition specifically, because everybody that has MS maybe has mild symptoms versus more extreme symptoms. So definitely reach out to us and explain your case and what you experience, and we can go from there.
Okay, what are some suggestions to build up your blood count before surgery?
So that's where the vitamins would fall in. So definitely Floridix, Hemoplex, vitamin C, and folic acid.
Yeah, so Hemoplex, I took before my liposuction procedure. I took pretty consistently 2 weeks ahead of time, but my hemoglobin was 13. So I started off pretty high, but I really wanted to ensure that my blood was boosted and ready for liposuction. So you can start even maybe a month before surgery, take it twice a day, 3 times a day if you have to, really to just set yourself up for success as best as possible.
Okay, so this is for you, Sarah.
Oh boy.
So out of the subject, but can you show how you are sitting on your BBL
Oh
pillow?
my gosh, sure. So
Yeah, they know.
There you go. So I'm about 5 weeks post-op liposuction 360 with fat transfer. So I have my BBL, my fun little friend here, my BBL pillow.
Your soul sister.
So I have it here on the chair, and then I kind of like hop over it, and my thighs, if you can see in the video, are like right under it, and my booty is hanging off the back. So this has been my life for the past 5 weeks. Driving with it, eating dinner with it, standing for dinner, but this is it. It's worth it.
So it's possible, right?
It's possible. Yeah, absolutely. It's worth it. It's a lot of time, it's a lot of money, and no pressure to the booty is the best way to keep your booty active.
How many years are implants supposed to be replaced? You have
You
that?
want me to take it? Yeah. Okay. So there used to be a lot of discussion with implants when they first came on the market that you have to replace them after 10 years. But now there's a lot more research coming out, and the development of implants has advanced a lot. So The implants that we carry is natural, and they actually don't have a required like removal date. It's recommended after the age of 40 to have a mammogram and breast check every year. So you can have that check every single year. If your implants are doing great, there's nothing wrong with them. If you aesthetically like the appearance, you actually don't have to replace them at a certain time. It's really how you're feeling. If you're safe and you're healthy, then you can keep them for really as long as you like.
Okay, Sarah, this is for you too because I know you have the experience. Yeah, I'm sorry, but this is like an interview.
Tell me some questions.
Yes, bring the questions, girl. So, do you lose all your progress if you get or why after a BBL? So
About the shape, maybe?
yeah.
So the fat injected is a little traumatizing to the fat cells moving from this area to this area. So they are cut off from their blood supply. So you do see a little bit of loss in projection, a little bit of loss in overall volume just due to the nature of the surgery, transferred them from one place to another on the body. But I mean, I'm eating a lot of like dairy products,
Healthy fats.
Yeah, healthy fats, avocados, salmon.
Pistachios.
I do eat pistachios for a snack every day. So I guess of course it is very patient specific, but some is expected to be lost. But that's why our post-op instructions are important to ensure that as much stays too.
Okay, Dr. Vidal is online with us, and she
Oh,
said,
boy.
"My girls
I
love this," and she doesn't say, "Hey Willie, I love you." Nothing to me, okay?
Oh, really? We both
Hi,
love
Dr.
you too.
B.
Hi, Dr. B.
Okay, if you get pregnant after a BBL, something happens.
Okay. Well, you'll gain weight in your abdomen area. Your abdomen area, of course, will change. Your skin will be a little lax, a little loose after surgery. So it's hard to say after the baby's born what happens to your skin after, but
It really depends on quality of skin.
yeah,
I would
for
say.
sure.
Yeah. Okay. I think we're almost going to the
Straight
end
from
of the
pre-op.
questions. Yes. Yes. This one, when getting a mommy makeover, you have an idea if can the curve show as much as a lipo 360?
So during a mommy makeover, which is a tummy tuck, they do lipo the flanks area, so that does give you like the sculpting that you need to mold the area. So you're not you don't look like a square. You
Yeah,
do
that's
have
what
more
I'm saying.
curves. Yeah, exactly. And then of course with a flat stomach.
Yeah, but if we're comparing that to like a 360, with the tummy tuck, they, at least our doctors, don't remove fat necessarily on the like abdomen region. We want to ensure that a strong blood supply gets to the incision, so they actually don't remove any fat here. So if we're comparing just true fat removal, it's a little different. Depends on what your goals are.
Okay, girls, this question is how to get an appointment. I think
You
it's a
should
free-
call us. Call us. Come into the office if you're a local patient. Get on our website. There's
Inquire.
Inquire through the questionnaire. We have virtual consultations with the doctors. You'll talk with the coordinator. Super easy. A lot of ways to talk with us. Yeah, all done.
Any
Awesome.
questions?
Cool.
Okay, look at this. This Melly says, loving my new body, love the pure crew.
Yay.
Awesome, Melissa. Super happy for you.
Okay, look at this. Look at this. I love this. This is not a question, I'm sorry. But this says, how many employees are there? I love to send you all something, maybe
Some
liver,
pastitas,
meal,
some
or
croquetas.
dessert.
Send them over.
You can have it, Sarah.
How many employees do we have? Yeah, 30?
Yeah, I would say 30. About
Between
30.
the operating room, the sales department, we'll say 40 so we get a lot.
Yeah.
Maybe.
Yeah.
Cool.
Okay.
Thank
well,
you, whoever that was.
Bye, everyone.
Bye.
Thank you for joining our live.
Thank you. Yeah, awesome. Bye, everybody.